Hello, everyone. Thank you for joining us today. For the reporters who have joined us, I ask that you please put your questions in the group chat. They'll be moderated at the end. And also please mute yourselves at this time. Joining me today with staff and speakers include, please mute as you come in. Thank you. Okay. Joining us today, we have Chief Kevin Foster from the Norman Police Department, Chief Travis King from the Norman Fire Department, who also serves as our Emergency Management Director. We have our City Manager, Daryl Pyle. We have Dr. Gary Raskob from the OU Hudson College of Public Health, Brittany McGill, Chief Nursing Officer at Norman Regional, John Woods, the Executive Director of Government Affairs from the University of Oklahoma, and Scott Martin, President of the Norman Chamber of Commerce. I'm excited to have you all join me today in this new format. It's a great example of how we are being flexible and versatile in the challenging time we find ourselves today. We are meeting today specifically to discuss new restrictions being put in place to help Norman manage and hopefully control the spread of COVID-19 in our city. The test results are coming in faster now, but there is still a huge lag time in getting those results. And with the rise in confirmed cases from 16 to 22, we have seen a 37.5% increase in Cleveland County in one day. Cases statewide are at 109, which is again over 30% increase in one day. We have also had our first death here in our community caused by COVID-19, a woman in her 60s with no underlying health conditions. This is the hardest thing I've ever had to announce as an elected official, and my heart goes out to the family of this woman. I am so very sorry for your loss. Our city and state are uniquely positioned to see what policies and initiatives around the world have been successful in slowing the spread of the coronavirus. The actions we are announcing today line up not only with what the cities, counties, and states are doing all over nation, but it also follows the recommendations of what 21 different medical associations in Oklahoma believe is the necessary course of action to fight the spread of this virus. It also aligns with what the governor recently announced just an hour ago. We do not have the luxury to wait for these things to get worse before we take action to slow the spread and protect our community. These actions will also protect our healthcare workers and first responders and hopefully avoid overwhelming our healthcare system as a whole. To address the challenges facing our city today, both those known and unknown to us, and to align with the governor's recently announced order, I am issuing a stay-at-home order and the closure of all non-essential businesses that will take effect along with the governor's order at midnight tomorrow night, Wednesday, March 24th. It will remain in place in 21 days ending on April 14th at midnight. We are asking Normanites to stay at home except for essential activities. We need you to take this seriously. The consequences of your own health and that of others and the safety is what will happen and to be at risk if this continues to spread. At the end of those 21 days, we will evaluate the status of our community and decide if it needs to be extended or not. Following this conference, the proclamation and information on what constitutes essential businesses will be listed on the city's website. Please know that these decisions aren't made lightly. You could tell the governor shared the same concern that I have today. It's a balancing act between protecting the safety of our people and the safety of our economy. But we always must err on the side of public safety and put the health of our residents first. We know that this will impact businesses and employees of those businesses, which is why this order will start with 21 days. I have consistently maintained that the sooner we get ahead of and control the spread of this virus, the sooner we can get back to life as normal. We in Oklahoma are no strangers to natural disasters. When we know they're coming, our trained professionals tell us to listen to them and follow their advice so we can stay safe. That is exactly what is happening here. COVID-19 is here. We are listening to our state's medical professionals and we are listening to our scientists. The stay-at-home order is the best decision we can make with the information we have at this time to keep our community safe. I appreciate everyone staying home as much as possible, social distancing, washing your hands. We will get through this. We will. And again, the sooner we take these orders seriously, the sooner we can get to that time. And with that, I will turn it over to Dr. Raskob.
Thank you, Mayor Clark. Thank you for the opportunity to share with you today. And let me, as a public health professional, commend you for taking this action and our other leaders for doing this. And I thought just in a few minutes that I have here with you, maybe it would be helpful if I give a little bit of scientific background as to the rationale for why this is so important and crucial, and then that may help people to understand further the importance of complying with these measures, which sometimes can be inconvenient or imposing or have some hardships. So very quickly, COVID-19 is a highly transmissible infection. On average, a person infected with COVID-19 will infect 2 or 3 other individuals. And the average time it will take for them to do that is only about 4 days, often well before they may show symptoms of the infection. So we know that this is in our community. We know that it can be spread by minimally symptomatic or people without symptoms, and that there are likely to be people who are infected with this virus and able to easily transmit it to others that we don't know. And that's why we've had to move from the approach of isolating symptomatic cases and tracing their contacts to a more aggressive approach, which we call mitigation, which involves this approach of limiting and preventing new exposures and transmission. And so the virus, we have no vaccine at the moment for this. We have no effective known antiviral drugs specific for this condition. And the only way now that we can dampen and limit the impact of this in our community is through these measures to reduce new exposures and prevent transmission. And that's crucial. And the goals of this really are twofold. One, of course, to limit death and disease that will occur from this, but also, secondly, to limit or dampen down the total number of infections and delay the time by which we see that peak of total number of infections so that our health system is not overwhelmed by patients with this condition. And so it may help people to appreciate and follow what's happening in Italy, where they were quite, let us say, relaxed about taking measures early in the course of this as it progressed through the community, and they're in terrible, dire straits now, where their health system is overrun with people who are sick, where they're having to make very heart-wrenching, awful decisions about which patients will receive care and who won't, and that means who will live and who will die. And our goal is to not become that, and that is the crucial thing. And so these measures, all of them that are being taken, are designed with the goal of limiting personal contact between people, close personal contact, through whatever mechanisms, that is one-on-one, where you want to be at least 6 feet apart, eliminating group meetings, reducing the number of
Hold on, Dr. Raskob, I can't hear you.
I think we lost his audio.
Mr. Raskob, can you hear me? Dr. Raskob.
We may need to move on. If we can now hear from Brittany Langston at the Norman Regional Hospital.
Sure. Thank you so much for having us. So I wanted to start with thanking the entire health system. We call our employees healers. No matter what role they work in, they serve a common purpose, and that is to provide healing to our patients and our families and our communities. And throughout all of this constant change, part of that change includes the roles in which our healers perform. We have multiple healers that are doing jobs that they didn't sign up for and that they don't normally do. And I think it's just a huge testament to the mission and vision of this organization. We want to thank the Cleveland County Health Department and the State Health Department. They have been a tremendous help and assistance to us. We also want to thank our community partners. We're all in this together, and as things continue to evolve and change, it's because we're coming together to deliver a consistent message. And so we're grateful for that. I'd like to comment on the fact that as a health system, we are trained in disaster preparedness. And by sharing that, I want you to know that you're going to see different things that you haven't normally seen in this health system. Things that look like trailers outside of our emergency departments. We have emergency tents that we will be putting up as well so that we can have pre-hospital staging. And that is to prepare for a surge of patients that present to our emergency departments. Our hope is to keep those patients that are presenting safe, as well as the patients that are already inside the building safe. And so those are things that you're going to start to see evolve. We are working closely with Metro hospitals to partner and deliver one message together. An example of that was the United Front decision to cancel all elective surgeries. Yesterday, we made the very difficult decision to partner with them again to make the visitor restrictions even more stringent. And so as of last night, we had to make the tough choice to turn visitors away, and that is so that we can protect patients and the community members from the spread of this disease. It was a very difficult decision to be made, but I think that it goes well with the mayor's decision to stay at home. I want to comment on how grateful we are for the health department's assistance as we've been working through investigating some processes and policies together, and that's been very helpful. I'd also like to let people know that we do have a contingency plan should we have a large influx of patients to care for. So units have been dedicated so that we can cohort patients together, as that's what's recommended by the CDC. And we are being very quick and nimble to adjust our care plans to be able to treat those patients no matter what level of care they may require.
Thank you. All right, we will now move on to, I believe, Mr. Woods from the University of Oklahoma.
Well, thank you, Mayor, and thank you for convening this meeting and sharing the efforts of our Norman community. And I can tell you that as a proud employee of the University of Oklahoma, we've really led the way in the charge in responding to this virus for the safety of our students, our faculty, and our staff. And whether that have been our first actions of canceling study abroad programs to very quickly moving to online post spring break and now extending online education through the rest of the semester. I feel that your executive order and the governor's order is really in harmony with where the university is already at, which is to say that we wanted our directors and supervisors to implement a telework program where it is possible for our faculty and staff to only have essential personnel that is in person working at the university campus, and to do so in ways that are safe and effective to mitigate the potential for the spread of coronavirus. This is really in concert with the expertise that OU has through our Health Science Center. We had Dr. Raskob on earlier. He is one of a great team of leaders that has consulted us from day one to give the best possible medical advice that has really guided the policy of the university and our administration. So appreciate the leadership of the City of Norman, for all of our leaders across the state that are trying to be as responsible as possible. And remind everyone that the actions that we undertake has a significant impact on our friends, on our neighbors, on our coworkers, and on our families. And I know that is first and foremost in the mind of President Harris and our administration, I know it's first and foremost in your mind, in your leadership, and our city council. And as our state moves forward and responds to this effectively, we will see the results mitigated as best as possible by the actions that we all take. So we join and support you in what we think is an order that is in harmony with where the university is at, as we all respond to this.
Thank you, Mr. Woods. I agree with all that OU has done, and I just want to say thank you for that. You know, we consider all of those students student residents, and it's our job to take care of them as well. And I very much appreciated how we've worked together to face this unprecedented situation. So thank you again.
Absolutely.
With that, Mr. Martin from the Chamber of Commerce.
Thank you, Mayor. Appreciate the invitation to be part of this press conference today. And first, I certainly want to extend the business community's support of these efforts to protect people. We want Norman to be healthy and safe, and the steps you've taken up to now certainly contribute to that safety and well-being, and certainly the efforts that you're making today and those of the governor will lend to that safety and well-being also. One thing that I didn't hear or read in the declaration is that Norman is closed for business. Rather, quite the opposite.
Mm-hmm.
Emphasize is that Norman is open for business. It's just that business will be operating a little differently in the coming weeks. And I want to encourage people to look for opportunities to be creative, insightful, and encouraging to the business community. As I've stated before, businesses aren't a building or a website or anything like that. They're the people that we're trying to look out for and care for. And whether it's the business owners or the employees that might be having a reduction of hours, our goal at the Chamber of Commerce is to support those businesses and individuals as they get through this. There's some common sense steps that people can take. We want to encourage people to continue to look for ways that they can get things to go. A lot of people have delivery service, curbside services, maybe to go pick up, that kind of thing. You can even buy in advance, whether it's purchasing a gift card today and using it later on. Certainly, many of our businesses are online, and so look for opportunities to follow them in ways that they're asking for support. Many of our businesses have shopping online, and so we want to encourage people to shop online locally and get items shipped to their house that way. Stay looped in to what's going on, maybe continuing that membership that you have with a business. And then lastly, saying thank you to the business owners and workers who are certainly putting themselves at great risk in providing a service or good for the community. But we stand with you, the other individuals on this call, because we're in this together, as it's been said, and together Norman's going to get through this, and the business community is going to stand shoulder to shoulder with the rest of the parties that are on this call to see that we get through this together and well.
I agree. Thank you, Mr. Martin. I want to emphasize again what we have done from the beginning. By taking decisive action now, we will hopefully flatten the curve and not only protect our first responders and healthcare professionals and our healthcare system as a whole, but our businesses by reducing the long-term impact. Because the sooner we get a hold of this thing, the sooner we control it, the sooner we stop the spread, the sooner we can get back to life as normal. And I appreciate every single business that has taken innovative steps to change how we do business. You are spot on. We are not closed for business. We are just changing how we do business here in Norman. And we are very creative, we're innovative, we're hardworking, and we will get through this. And I'm excited for the fact that when this is past us, which will be hopefully sooner than later, we will have policies and different standards in place that will make us better in the long run, and I'm confident for that. So with it now, I will turn over to Ms. Meyer, our communication director, to field the questions that we are receiving.
Yes, we are getting questions right now from a couple stations about in terms of enforcement, how will we be enforcing, and will there be charges for violations? For businesses that remain open, will we be regulating group sizes? I think this should go for City Manager Pyle and Chief Foster, if Daryl would like to kick us off with the answer to these questions.
Absolutely. Thank you. And with that question, our goal is compliance with the order. Our goal is not to write tickets or close businesses. In instances where larger crowds are gathering, our approach will be education as to what is included in the order and what it means in terms of maintaining social distances and crowds of no more than 10 in organized gatherings. So our police officers would be more than happy to visit with businesses that don't quite fully understand the implementation of the order. And now this is much more inclusive with the 19 counties affected by the virus. And I think we'll see similar measures applied throughout central Oklahoma. But goal one is compliance to achieve public safety.
Chief Foster, did you have any additions to that?
I agree wholly with him. Our whole idea here is to educate the public to keep them safe.
Great. Well, it doesn't look like we're receiving any more questions at this time from press, but we will be issuing the proclamation. Will be up on our website, and we will have an updated FAQs and additional information for everyone on our website in just a few minutes. So.
Thank you all for joining us today. These are unprecedented times and they take unprecedented actions. And I'm very proud of what we are doing here today. I'm very grateful to the governor for issuing his order. These orders are a lot more effective when they're taking as whole counties as opposed to just cities. So thank you to him for that. And we will look for more guidance from what he hands down. But we will get through this. I want to emphasize that yet again. I want to make sure that you all keep your heads up and stay at home and explore all the ways to stay connected with your neighbors and your family through this tough time. We will get through this, and these actions like we're doing today, that'll help us get there faster. So thank you for joining us today, and stay in touch with the website for the order and the updated FAQs.
They will basically be able to leave their house for things such as walking their dog, taking their kids to other parents' houses, things like that.
Okay, so we did have a question from the YouTube feed about, can people leave their houses? Yes, you can leave your house. It's beautiful outside. Go for a walk, get some exercise in. My dog has gotten more walks in the past 2 weeks than he has in like 2 months, so he's loving this as well. If you need to transport children to someone else's house so they can be watched, that's fine. If you need to leave your house to go provide a meal to a neighbor who can't leave their house, that's fine. No one is this is not a lockdown. This is not martial law. This is encouraging people to social distance by staying at home and not getting out unless you have to. So I hope that's clarification. If you do go to city parks, please be aware that other people will be touching it. So wash your hands, use hand sanitizer, common sense ways to stop the spread of germs. But yes, please get out inside and enjoy the weather. We're not asking you to lock the doors. We're just asking you to keep distance from others and help us stop the spread and flatten the curve.
Madam Mayor, I did have one additional question.
I'm just recording still.
Okay.
So Annalise, I had a question posed. The question was, will workers moving to and from those essential jobs and industries be required to show paperwork to anybody that they are an essential employee heading to work or heading home from work? And the answer to that question is no. There aren't papers to be issued showing that you are an authorized essential employee. But I think we'll see a greatly reduced traffic since the schools are currently out of session and doing distance learning, there'll be a lot fewer vehicles on the road. We just encourage everybody to follow the order. But if you're headed to work, you're one of those essential industries, don't worry, you won't be stopped. And the police department will not be asking for any paperwork verifying who you are or where you're going. So it's not an enforcement action like that at all. If you are an essential employee and your industry is listed in the proclamation, by all means, go to work and keep supporting all of those who are helping us get through this current situation as efficiently as possible. Thank you.
All right, I'm not seeing any other questions at this time. So with that, I'm going to conclude this press conference. Again, thank you for joining us. Thank you to all of our community partners. We are stronger together, and we will get through this together. So until next time.